Shauna, let me begin by very sincerely thanking you for being here today, because it takes a lot of courage to talk about your personal story, about your mom having Huntington's disease, about the sacrifices that would be made by your own family if these healthcare tax credits are not extended, about the real-life impacts on you. It takes bravery to do it. And so I'm going to explore a little bit more about that story and about the powerful way that you've articulated what it means to have, in your words, peace of mind, knowing that your mom had Huntington's disease and that it is a genetic disorder. And I have to tell you, I am struck by your description of the meeting recently of your Huntington's disease community, your state chapter, when you heard about a new treatment that might be available. Very exciting for people, and I'm quoting you, none of these individuals did anything to deserve the genetics they were dealt, and they deserve affordable, reliable health care just like every one of us. That new treatment will be available to them only if they have health insurance, correct?
I assume so.
And they're your friends, your neighbors, and your own family, because we all know that your two beautiful children inherit the genetic makeup of your family. So I wonder if you could talk a little bit more about how you're affected in the way you look at your kids when they go to bed at night, the way you see your family, the way you and your husband think about your lives, and the possibility that you may not be able to afford health insurance.
Yeah, well, it's caused some very serious conversations in our household the past several months since we've known the possibility of not having this extended premium tax credit, and already working really, really hard to make ends meet. We are having these conversations about what else we can cut out. For a while, the conversation included, do we just go without health insurance? But that's too big of a risk that we don't feel comfortable doing. And right now, we're leaning toward my husband leaving the small business that we love so that we can have affordable health care.
And the treatment that's potentially available to people who suffer from Huntington's disease will be available only if they have that health insurance.
Well, unfortunately, that's still probably a few years in the works before that's available. But yes, it will require health insurance to be able to afford that. It'll be a pricey treatment.
Any new medical or
yes,
scientific
of course.
advance.
But anybody with Huntington's or living positively with Huntington's relies very much so on health care. And even somebody who is tested positive who might be very healthy for a long time, before the Affordable Care Act, they were not able to get coverage because of the knowledge that they will become sick someday.
Now, that new treatment could well be expensive.
It will be very expensive.
Sometimes advances in medical care are expensive, especially if they are newly developed and they haven't been mass produced, like pharmaceutical drugs become less expensive the more generics are available, correct?
Mm-hmm.
I hope that we will take action to lower the costs of health care. And I've actually strongly supported those kinds of efforts. I've consistently called on insurers to reduce their rates and on providers and drug manufacturers to reduce the costs of their services or products. I've also led investigations into abuses by insurers participating in the Medicare Advantage program. I'm hoping the chairman will join this effort. One thing that will reduce costs is giving Medicare more power to negotiate lower drug prices. I'm hoping the chairman will join me in that effort as well, and others on this committee. And I believe strongly that we can help eliminate fraud in this system by taking action against the insurers, brokers, and navigators who are exploiting the weaknesses in this system for self-gain. And that's why I have sponsored measures to take action, particularly enforcement action, against them. One is the Insurance Fraud Accountability Act, which would impose criminal penalties on brokers who engage in deceptive marketing or enrollment practices. I'm hoping maybe the chairman will join me and other Republicans as well. These are specific steps we can take to stop fraud. We should have zero tolerance for fraud, no matter whether it's in the billions or the pennies. I hope all of the witnesses will agree with me on that point. But it doesn't mean throwing the baby out with the bathwater, as the saying goes. It means focusing, targeting, and using new laws as well as existing enforcement authority and giving them the resources that they need to go after fraud. So I'm hoping that we will have a second round of questions, Mr. Chairman, when we can explore some more of these issues. I have additional questions, and for right now, I'm going to abide by the time limit because my time has expired.
Senator Scott.